PT141, also known as bremelanotide, is creating a buzz in the world of sexual health. It's a synthetic peptide hormone. This means it's a lab-created version of a naturally occurring hormone. PT141 works differently than traditional erectile dysfunction medications. It targets the brain to enhance sexual desire and function. This makes it a groundbreaking option for both men and women. PT141 is not just about achieving an erection, it's about reigniting the spark of desire. Many people struggle with low libido and sexual dysfunction. These issues can stem from various factors. Stress, anxiety, and hormonal imbalances can all play a role. PT141 offers a new approach to addressing these concerns. Traditional ED medications primarily focus on increasing blood flow to the genitals. While this is important, it doesn't address the psychological and emotional aspects of sexual desire. PT141 takes a more holistic approach. It influences the brain regions responsible for sexual arousal and satisfaction. This innovative peptide has the potential to revolutionize how we approach sexual health. It offers a promising solution for individuals seeking to improve their sexual well-being. PT141 addresses both the physical and emotional components of intimacy. Understanding how PT141 works requires a glimpse into the intricate workings of the brain. Our brains are a complex network of neurons. These neurons communicate with each other through chemical messengers called neurotransmitters. Some of these neurotransmitters play a crucial role in sexual desire and arousal. PT141 specifically targets melanocortin receptors. These receptors are found in the brain. They are involved in regulating a variety of functions, including sexual motivation. When PT141 binds to these receptors, it triggers a cascade of events. These events lead to the release of key neurotransmitters. Dopamine, often referred to as the feel-good hormone, is one such neurotransmitter. Dopamine is associated with pleasure and reward. Norepinephrine, another important neurotransmitter, plays a role in arousal and alertness. And oxytocin, known as the cuddle hormone, promotes feelings of bonding and connection. By increasing the levels of these neurotransmitters, PT141 essentially amplifies the signals associated with sexual desire. This can lead to increased libido, enhanced arousal, and a more satisfying sexual experience. Unlike traditional ED medications that focus on the plumbing, PT141 addresses the control center, the brain. This makes it a potentially more effective solution for individuals struggling with low libido or sexual dysfunction rooted in psychological factors. PT141 offers flexibility when it comes to administration. This is a key factor in its growing popularity. Different people have different preferences and lifestyles. PT141 accommodates these individual needs. Let's explore the various ways this peptide can be administered. Injections are a common method for delivering PT141. The peptide is typically injected subcutaneously. This means it's injected into the fatty tissue just below the skin. Common injection sites include the abdomen, thighs, or upper arms. Injections allow for precise dosing and rapid absorption into the bloodstream. For those who prefer a needle-free approach, nasal sprays provide a convenient alternative. Nasal sprays deliver PT141 through the mucous membranes in the nose. This allows for direct absorption into the bloodstream. Nasal sprays are discreet and easy to use. They are an excellent option for individuals who may be uncomfortable with injections. Another delivery method gaining popularity is sublingual administration. This involves placing PT141 under the tongue. The peptide is absorbed through the mucous membranes in the mouth. Sublingual administration offers a balance between convenience and rapid absorption. The availability of multiple delivery methods makes PT141 a versatile option for individuals seeking to improve their sexual health. Whether you prefer the precision of injections, the ease of nasal sprays, or the discreetness of sublingual administration, there's a method that suits your needs and preferences. PT141 has garnered significant attention in the medical community. In 2019, the US Food and Drug Administration granted approval for PT141 to treat a specific condition in women, hypoactive sexual desire disorder, commonly known as HSD. HSDD is characterized by a persistent or recurrent lack of sexual thoughts or fantasies and a lack of desire for or receptivity to sexual activity, which causes marked distress or interpersonal difficulty. This FDA approval marked a significant milestone in the field of sexual health. It acknowledged the importance of addressing low libido in women, a condition that has often been overlooked or stigmatized. However, it's essential to note that PT141's potential benefits extend beyond HSDD and are not limited to women. While PT141 is not yet FDA approved for treating sexual dysfunction in men or for other off-label uses, healthcare providers can legally prescribe it for these purposes. This practice, known as off-label prescribing, is common in medicine. It allows doctors to use their clinical judgment and expertise to tailor treatments to their patients' individual needs. Off-label use of PT141 in men has shown promising results in addressing a range of sexual health concerns, including erectile dysfunction, low libido, and premature ejaculation. The peptide's ability to target the brain's sexual response system makes it a valuable tool for men who may not respond to traditional ED medications or who are seeking a more holistic approach to improving their sexual well-being. Section 5. The PT141 advantage, addressing the root of sexual dysfunction. Traditional ED medications such as Viagra and Cialis have long been the go-to solution for men experiencing erectile dysfunction. These medications work by increasing blood flow to the penis, which is essential for achieving and maintaining an erection. However, they don't address the underlying psychological or emotional factors that can contribute to sexual dysfunction. This is where PT141 sets itself apart. Unlike traditional ED medications that focus on the mechanics of an erection, PT141 targets the control center of sexual desire, the brain. By influencing neurotransmitters like dopamine, norepinephrine, and oxytocin, PT141 enhances sexual desire, arousal, and satisfaction. This unique mechanism of action makes PT141 a particularly appealing option for individuals struggling with low libido or sexual dysfunction rooted in stress, anxiety, or other psychological factors. It can help reignite the spark of desire and improve overall sexual satisfaction. Moreover, PT141 offers a potential solution for individuals who haven't found success with traditional ED medications. Some men may not respond to these medications due to underlying health conditions or other factors. PT141's distinct mechanism of action provides an alternative pathway to address their sexual health concerns. Section 6. Understanding potential side effects. A balanced perspective. As with any medication or treatment, it's essential to be aware of potential side effects. PT141 is generally considered safe and well tolerated. However, some individuals may experience mild to moderate side effects. These side effects typically subside on their own within a few hours. Common side effects of PT141 include flushing, headaches, nausea, and injection site reactions. Flushing, characterized by a feeling of warmth and redness in the face and neck, is the most commonly reported side effect. It is usually mild and transient. Headaches are also typically mild and can be managed with over-the-counter pain relievers. Nausea is less common and usually subsides quickly. Injection site reactions such as redness, swelling, or itching may occur, but are generally mild and localized. In rare cases, individuals may experience more severe side effects, such as blurred vision, dizziness, or increased blood pressure. It's crucial to seek immediate medical attention if you experience any severe or persistent side effects. It's important to note that the incidence and severity of side effects can vary depending on individual factors such as dosage, administration method, and overall health status. Before starting PT141 or any new treatment, it's crucial to consult with a qualified healthcare professional to discuss your medical history, any existing medications you're taking, and any potential risks or concerns. Section 7. Timing is key. Onset and duration of PT141's effects. Understanding the onset and duration of PT141's effects is crucial for optimizing its benefits. Timing can vary depending on individual factors and the chosen administration method. However, some general guidelines can help you plan ahead and maximize your experience. When administered via injection, PT141 typically takes effect within 30 minutes to 2 hours. The effects can last for several hours, with some individuals reporting benefits for up to 72 hours. This prolonged duration of action is a significant advantage over traditional ED medications, which typically last for 4 to 6 hours. Nasal sprays may have a slightly faster onset of action, with effects noticeable within 15 to 30 minutes. However, the duration of effects may be shorter compared to injections, typically lasting for a few hours. Sublingual administration falls somewhere in between, with effects typically felt within 30 minutes to an hour and lasting for several hours. It's important to experiment and find the timing that works best for you, as individual responses can vary. Factors such as metabolism, body weight, and food intake can also influence the onset and duration of PT141's effects. It's always a good idea to start with a lower dose and gradually increase it as needed under the guidance of a healthcare professional. This will help you gauge your individual response and minimize the risk of side effects. Section 8. Expert opinions on PT141. Voices from the medical community. PT141 has garnered significant attention and support from medical professionals specializing in sexual health. Leading experts recognize its potential to address a wide range of sexual dysfunctions, particularly those with a psychological or emotional component. Dr. Adaobi Anyeji, a board-certified psychiatrist and expert in sexual medicine, highlights the significance of PT141's unique mechanism of action. Unlike traditional ED medications that primarily target blood flow, she explains, PT141 works directly on the brain's reward and motivation centers, enhancing sexual desire and arousal. This makes it a game changer for individuals struggling with low libido or sexual dysfunction, stemming from stress, anxiety, or relationship issues. Dr. Erwin Goldstein, a renowned urologist and sexual medicine specialist, echoes this sentiment. PT141 represents a paradigm shift in how we approach sexual health, he states. Its ability to address both the physical and psychological aspects of sexual desire offers new hope for individuals who haven't found relief with traditional treatments. These expert opinions underscore the growing recognition of PT141 as a valuable tool in the field of sexual medicine. As research continues to explore its potential applications and long-term effects, we can expect to see PT141 play an increasingly prominent role in helping individuals achieve optimal sexual health and well-being. Section 9. Beyond PT141. Exploring other peptides for erectile dysfunction. While PT141 has taken center stage in the realm of peptide therapy for sexual dysfunction, it's not the only player in the game. Several other peptides have shown promise in addressing erectile dysfunction and improving sexual health in both men and women. Ipamorelin, a peptide known for its growth hormone-releasing properties, has also demonstrated potential in improving erectile function. By stimulating the production of growth hormone, ipamorelin may help increase blood flow, enhance muscle mass, and boost energy levels, all of which can contribute to improved sexual performance. CJC 1295, another peptide that stimulates growth hormone release, has also garnered attention for its potential sexual health benefits. Like ipamorelin, CJC 1295 may indirectly improve erectile function by promoting overall hormonal balance and well-being. BPC 157, a peptide known for its wound healing and regenerative properties, has shown potential in animal studies to improve erectile function by repairing damaged tissue and promoting the growth of new blood vessels. While human studies are needed to confirm these findings, BPC 157 represents an exciting area of research in the field of peptide therapy for sexual dysfunction. It's important to note that research on these peptides is ongoing, and their long-term effects and safety profiles are still being investigated. As with any medical treatment, it's crucial to consult with a qualified healthcare professional before considering peptide therapy for erectile dysfunction or any other health concern.